I am Dr. Sanjay Pandey, consultant urologist at the Kokilaben Dhirubhai Ambani Hospital in Mumbai. Interstitial cystitis bladder pain syndrome is an issue where when the bladder fills up, the urinary bladder has a filling phase. When the bladder fills up, the individual has got discomfort, the individual has got pain, the individual cannot hold urine, has to go and rush and pass urine because there's a pain, discomfort, issues that an individual cannot handle. This is sadly more common in women. Men also suffer from this phenomena where there are other more domains that happen around. So somebody has got a pelvic pain, pressure or discomfort related to urinary issues where you have got frequency, urgency, not able to control, where you got a burning sensation in the region of the genitals, where you got discomfort and pain which is not appropriately described by any test. Are you dealing with interstitial cystitis bladder pain syndrome? Maybe starting with a vague phenomena of some discomfort, some UTI which caught a flare of it, and thereafter it has progressed to a situation where I cannot hold urine because my holding of urine is painful. I cannot let my bladder fill up to a capacity because it's painful. I've got burning sensation in the urinary passage. It's not that my urine is burning, but I've got a burning sensation when the urinary passage is touched. I've got a burning sensation when I'm sexually active. I've got pain and discomfort in the region of the groin, the genitalia, more women than men. And this is sadly missed out. It's been misdiagnosed many a times for decades together as a recurrent UTI, as an overactive bladder, as perhaps sometimes also endometriosis. But remember, all these phenomena can coexist. That means a woman with a bladder pain syndrome can also have endometriosis in her. A woman with bladder pain syndrome can worsen every time there is a UTI and UTI flares up to very high levels. A woman with a IC bladder pain syndrome can also have an overactive bladder. But the issue is about pain, discomfort, bleeding, burning, something where you cannot hold urine. And it's not since a day, week or a month. It has been there over a few months. It has only progressed. Attempted therapies gave a result, some degree of respite, and then again vaccine waning, and progression is on. So women suffering from this complain of discomfort, pain, pressure, pelvic pain, sexual pain, all those pain that happens in that area. They complain of burning sensation, not a proper UTI, but just that whole area burns. Some areas in the genital burns. Some women complain of not able to control urine. Some women complain of changes in the menstrual periods and more discomfort. The whole aspect is when the bladder fills up, there's a discomfort and the pain. And therefore, these people are also woken up from sleep, not because of urine, but because of pain and discomfort. So friends, interstitial cystitis bladder pain syndrome is a disease, it's a phenomena which has got many phenotypes, various kinds of presentation which people can have. So the vagueness of the lower urinary passage of discomfort, pain, pressure, where combined with urinary symptoms and you don't get relief for treatment with UTI, you eat something and you get a flare, for example, dark chocolates and coffee flares up your urine and you get more irritable, more discomfort. People who are not having a great phenomena in the cross organs in terms of genitals, in terms of the bowels or the motion passage where there's discomfort and pain along the perineal region, around the vagina, the vulva, the anal verge, all those burning and pain sensations described as either burning pain or pain and burning or pain while bladder filling is sadly very common. Let's not confuse this as a UTI or recurrent UTI. Let's also not confuse this as a tuberculosis which has got phenomena of progression which is evaluated with various tests. But look into these individuals with a lot of empathy. They suffer, they continue to suffer as more women than men, and living in various towns and cities across from two-tier cities to rural areas where the diagnosis has been missed. Whereas clinicians, we may not have spent time talking to them, understanding it and taking to the next level. So this is a treatable phenomenon. We can take this forward to the next level. It is important for us to identify this. At the Kokilaben Dhirubhai Ambani Hospital, while on one side we evaluate these patients, we also take them through the lifestyle changes, through a biofeedback and pelvic floor therapy, through medical management, through a cystoscopy and hydrodistension, identifying the bladder, looking at the prognostication of the individuals, looking at the diseases, and sometimes in end-stage bladder, which are very small capacity bladders, doing an augmentation cystoplasty. So again, a lot depends on which individual gets what kind of therapy, but ideally we need to take it forward to the next level. So it's important for us to take this awareness drive on interstitial cystitis bladder pain syndrome to the next level, to everybody in the society, more women than men, that if you have women complaining of pain, discomfort, burning, during bladder filling and the bladder cannot be filled up, have to go very frequently, not because the bladder is overactive as we did talk about, but bladder is painful. If that is all happening around in the region of the pelvis, you must see your urologist. At the Kokilaben Hospital that we see referrals, people coming around, we look forward to them getting treated and staying well and taking it to the next level of therapy. So friends, this is a treatable disease. This is a disease which can be taken long and protracted in terms of deviating its natural history from progression towards a small capacity bladder. And it's important for us to be aware on this subject because the medical fraternity is woken up. It is trying to help you out with various medications, various approaches and various surgeries to define and probably come to the end of this therapy where you get a satisfaction to your life in terms of not living in pain, agony, disgust, in terms of urinary UTIs flaring it up, or in terms of the bladder capacity gradually going down. IC bladder pain syndrome is a treatable phenomenon. Let's be aware of it and let's get it treated. Thank you.